Mental health at work is not a footnote. It's not a side issue. It is one of the most urgent and serious challenges that we face in Europe's workplaces today. Almost 1 in 3 workers across the European Union say that their mental health has been harmed by their job, by their professional activity. And that accounts to millions of Europeans that are exhausted by stress, that are overwhelmed by pressure and unsure how much longer they can keep going and keep working. And still, we must be honest, the stigma remains. Mental health is too often seen as a personal weakness, when in reality it is often the result of poor working conditions. And we must change that. We must address that. Psychosocial risk, excessive workloads, this always-on culture, the job insecurity, the lack of support, the harassment, these are real and preventable hazards. Just like physical risks, they must be taken seriously and systematically addressed. And this is not just a health issue, it is also an economic issue. Mental health problems at work cost us billions of euros each year, if we take account the absenteeism, the high turnover, the early retirement, just to name a few of the problems. They drain talent, they drain our productivity and the potential from our society. But we are acting to improve these situations, and I would give some examples. First, of course, we are learning with and from our member states through exercises like the peer review that we carried out last year. In this peer review, member states agreed that they need to specifically address psychosocial risks at work in their national legislation, that they need to ensure effective enforcement of the rules together with more support and more guidance, that they need to have tailored training for their inspectors, that need to introduce guidance and counselling services on psychosocial risk at work, and the need to have more thematic campaigns to raise awareness. Another example of what we are doing already, we are bringing together workers, employers and governments, including through the Tripartite Advisory Committee on Safety and Health at Work, which has just launched a new working group on mental health and psychosocial risks. They will come with concrete suggestions by June of next year. We are also investing with more than 1.2 billion euros mobilized in the current EU budget for mental health issues in general. But I would mention some examples of investment related to mental health at work. First, we are supporting awareness with the EU OSHA Healthy Workplaces campaign on mental health that is starting next year and is focusing on new and overlooked groups of workers and sectors. I would also mention a recent call for proposals from Horizon Europe, call for proposals from the 2025 work programme that will be dedicated to projects that support improving mental health outcomes in education, in training and at work. Importantly, we are also supporting our labour inspectors through guidelines to more effectively address how employers are managing psychosocial risks during their visits, during their controls. Yes, our health and safety laws at European level already cover psychosocial risks. They do oblige employers to assess and manage such risks in a preventive manner and to establish health and safety procedures to do so. But some parts, like the Workplace Directive, date back to the 1980s, and work has changed, our jobs have changed, and our laws must change with it. Digitalization, telework, do bring more flexibility, more opportunities, but they can also blur the boundaries between work and life. This always-on culture that we are mentioning and is accentuating with increased risks of stress, of anxiety and of burnout. And this is the reason why we are looking at how to modernize our European legislation as part of the Quality Jobs Roadmap that we will adopt, that I will present by the end of this year. Honourable members, the Romans used to say, mens sana in corpore sano, the healthy mind in a healthy body. But the other way around is also very true. A healthy body needs a healthy mind. Mental well-being is not a luxury. It is the foundation of good, fair and modern conditions of work. And a Europe that protects minds as well as bodies is a stronger, more humane, a truly social and competitive Europe. And I want us to work together to building this type of Europe.